Believe it or not, the oldest baby boomers now heading into their 70s. And as we age, many of us will need more help and more care. Darlene Francis is Executive Director of Wernick Adult Day Healthcare Center. She came in to tell us about the work she and her staff perform, as well as the strict regulations that have limited the number of facilities eligible to provide elder care.
We're our medical model. So there are day programs that function as drop-in centers, but we're a medical model program. So we work very closely with the primary care physicians of all our participants. And we provide a secure environment for them. And we're able to monitor their health conditions so that if there's any changes that take place, as opposed to them being at home alone, we're able to alert the primary care physician ahead of time.
Now, does that mean you primarily are seeing folks with some healthcare problems, someone for whom it would be difficult to be alone for, say, an 8 or 9 hour period where everybody else in the family is out at work or school?
Yes. Our program, in our program, we deal basically with Alzheimer's, dementia, traumatic brain, memory loss. That's our population. Each daycare program has their own population, but that's our population that we deal with.
Okay. And let's explain, too, to folks who may not know, and we'll kind of explain how it all works, but Wernick Adult Day Healthcare is part of Jewish Geriatric Services, which for their own reasons has recently changed how they're known and identified. Now, I'll let you talk about all that.
Right. We are now known as JGS Life Care, and we're a continuum of services. So not only do we have the adult health program, we have the nursing home, we have independent living, we have assisted living, and we have home health and hospice. So it's a continuum of care for people that are aging, and we provide all the services for them.
And I know for years, the folks at now JGS Life Care, what was Jewish Geriatric Services, always were very careful to say, just because we are Jewish Geriatric Services, that doesn't mean we are limited only to the Jewish population.
Exactly.
And that's, I think, part of what's behind the name change, perhaps.
Well, we're rooted in Jewish values, but we serve all faiths. So our core values are Jewish. We're a kosher facility. We honor and appreciate all faiths. So that's basically
open to
where
all,
we are. Open to all.
But a basis in the Jewish faith
Yes.
and traditions. Let's talk about some things that have changed that make it difficult for you, for people in your industry, if we can call it that. Changes in the way government looks at adult daycare, adult day health care. And it really is complicating things. And in some cases, it's limiting the number of slots that are available for people to get. There have been changes in terms of government.
Right. For the last 2 years, the Department of Public Health has begun to regulate adult day health programs in the state, which is not always a bad thing. I mean, you know, the regulation is the regulation, and it brings continuity to the services that we provide for our participants. So on that side, it's good. However, there are some programs that have been in existence for a while that could not meet the financial regulatory challenges. So some of them closed. We were fortunate enough to be affiliated with the nursing home, with JGS Life Care. So we were able to make all of the regulatory changes that we needed, and we were awarded our licensure in January. So we are licensed by the Department of Public Health now. And, you know, so they're systematically going throughout the whole state. Wernick was one of the very first adult day health programs in the state. It was a pilot project by Mass Health, and we will be celebrating 40 years of existence in June. So we've been around a long time, and we do a good job at what we do.
And the fact is, Wernick and JGS Life Care, Jewish Geriatric Services for years before that,
Yeah.
have always had a great reputation
exactly.
for what you do and how you do it. Not always true of everybody that puts out a shingle and says, here we are, adult daycare or nursing home. And that's probably, I think, what was really behind the effort to step up some of those regulatory changes that hopefully weed out the bad guys,
Exactly.
but also can make life difficult sometimes for very good providers.
Right. Well, if you do what you're supposed to do the way you're supposed to do it, it's really not a problem, and we are good at that. The nursing home has been there over 100 years, so it's a very solid, very strong foundational organization, and so we're going to continue doing that.
The thing that always strikes me about a place like Wernick Adult Day Health Care is what it means to the caregivers, the family, whoever it is that has this person at home that comes to you each morning and stays until afternoon, early evening, whenever there's someone home again, to be able to care for them and be with them. Because it seems to me it can be a tremendous source of worry to have someone who may not be completely able to care for themselves in any sense, alone for hours at a time.
Exactly. We provide a safe, secure environment. We're in a locked facility. Our staff has been taking care of elders for years. We have 2 nurses that have a combination of 30 years of caring for the elder. I have 1 CNA that's been in the program for 30 years. 2 others that have been there for more than 15 years. An activities assistant who has been in elder care and promoting activities for them for over almost 20 years. So we have a staff that's grounded and rooted in the care of our elders, and we're all like family. It's a wonderful, wonderful place to be. We had a talent show, and it's amazing to see people with Alzheimer's and dementia and to reach into themselves to display. They sing, they dance, they have a good time, and it's just a wonderful thing to see.
And whenever I've met, people like you, your staff that you're talking about, they always say, we get as much, if not more, out of this than the folks that are coming to us, that are our patients or clients.
It is the best job I've ever had. And I've been working for a few years. And it's a very rewarding job. It's very touching. And it's something that you just can't explain. You have to experience it. So all of us that work in this industry, I feel the same way. I've talked to a lot of directors, I've talked to a lot of nurses and CNAs, and it touches your soul. It really does your soul good to work in an adult day health program.
Well, Darlene Francis, Executive Director, Wernick Adult Day Healthcare Center, thanks so much for coming in and sharing your story.
Thank you very much.